Foley catheter insertion. I would start by reviewing the order, making sure that the patient isn't allergic to anything that's in the kit. I would knock, identify the patient by asking their name and date of birth, provide for privacy, wash hands, and put on PPE as needed. And then I would start the patient for the procedure. I would have the patient, since he is a male, spread his legs just a little bit and have him slightly exposed. And then I would start by performing perineal care by putting on a clean pair of gloves. I would use clean washcloths. Start by cleaning from the meatus out, switching sides or switching washcloths, and wash up the shaft, wash down the scrotum, and dry. I would then remove my clean gloves and start by preparing my sterile field. And from here, move my jelly over. And then I would prepare my sterile field and put on my gloves. Then I would place this on the patient for any excess. Then I take the caps off the lubricant and take the hydrogen peroxide and pour it into the area. Dispose of this in the sterile trash that's over here. I'll place this into my sterile field. And then this syringe right here would have already been sterile, and it would have been my sterile water. And if I had contaminated my gloves at any point, I would have switched them out. I'll take this and go ahead and insert it into the catheter. Then I'm going to take my non-dominant hand, pull back the foreskin, lift up the penis, and take my syringe filled with jelly and fill it up all the way up, disposing of this into the sterile trash. I will then take my forceps and start by cleaning one swipe and start cleaning up the meatus, any of the excess jelly or anything of that. Then I will pick up my bag, keeping my catheter sterile, and placing it onto my sterile field. I will then take my catheter, tell my patient to take deep breaths, and slowly start inserting it. Up into the Y. And at this point, if my syringe came off, I would have to re-glove up or ask a nurse to glove up and help me. I would hold at the catheter, and this would have already been attached with my sterile hand, and I'll start by slowly inflating the balloon. Throwing that, and then gently remove back until I feel resistance. Then I will remove my sterile gloves, take my catheter, take my tubing to my patient's leg while hanging my bag on the side rail. Then I would wash my hands, clean up the patient, wash my hands again, lower the bed, make sure the patient is comfortable, and then I would report and record.